طيب، بسم الله الرحمن الرحيم، ومواصلة في المحاضرات حقت النيورو ديفلوبمنتال ديس اوردر مع دكتورة أماني. زي ما عارفين دكتورة أماني she is the chair of child and adolescent faculty of psychiatry في رويال كوليدج في ويلز، وكانت لنا محاضرتين على النيورو ديفلوبمنتال ديس اوردرز، ودي محاضرة ثالثة. افتكر حنغطي الليلة المواضيع بتاعة ال ADHD، وحنغطي برضو الأوتيزم سبيكترم ديس اوردر. تفضلي يا دكتورة أماني.
Okay. I hope everyone سامعني very clear. What we commonly know إنه ال ADHD is more prevalent in boys as opposed to girls. The reason I'm putting a photo of a girl هنا إنه in reality the prevalence بدأ يزيد في ال girls، والنسبة الزمان بتاعت 9 to 1 ولا 10 to 1 ولا whatsoever, this is not true anymore. I believe we moved to 6 to 1, and I believe the gap is getting narrower. I'm not gonna speak about probably the stuff that you can easily read or know about ADHD. I'm gonna touch base on that, but I'm gonna expand more on the bits that will help you make a diagnosis or help you with the stuff that is not clear. Okay, quickly. ADHD, we have to have inattention, and I've highlighted inattention in red, mainly because I don't know, for people who were attending with me the last time, I told you the main psychopathology in ADHD is actually inattention. Okay, so we have to have inattention symptoms, enough symptoms to make a diagnosis. We have to have hyperactivity symptoms, and we have to have impulsivity in order to become suspicious of ADHD presence. Another thing as well, these symptoms of inattention and hyperactivity and impulsivity should not be in one setting, should be at least witnessed in two settings. And also there should be an evidence of disability. I don't mean here disability by somebody being physically disabled, but disability or problems either socially or academically or both. So the child, for example, the parents will complain of that child is unable to form relationship or fights out or fall out with his friends all the time, or he's academically not achieving, okay? And it should happen in the developmental period. So I will have the family reporting these symptoms to me, and I will say this is one setting. Regardless of what the family will say to me, I need the evidence of another setting. That is why I send a questionnaire. I give a questionnaire to the family, and I send a questionnaire separately to the school to get for them to rate these symptoms for me, okay? And then from the forms, I can establish the social and academic disability. One of the things I want to warn you about, because I face this several times, is that the family will report these symptoms. They will fill the questionnaire. The child in that questionnaire will score high. But when you look at the teacher questionnaire academically, at the academic bit, one of the comments the teacher will say, there is no concern academically, all right? And here it is very important for you as a doctor to take that academic thing at the context. For example, I remember very well, a family came complained of severe symptoms of their child ADHD. And when I sent to the school said to me that he's achieving like any other child. Okay, so he's average. So for me here, yes, he's got the symptoms, but the symptoms are not affecting him academically, so I can't make the diagnosis. Yes, he's got the symptoms, but if you don't have a problem manifested, you cannot make a diagnosis. But when I digged further, that child, his mother was a lawyer and dad was a doctor. And when the teacher was talking academically, she was talking about an average school boy, but here his academic achievement should match his parents. I hope you're getting this very clear. So teacher can say, no, he's doing fine, but when you look at the parents' achievement as opposed to the child achievement, you'll find there is a drop. Okay, all these symptoms should happen in the developmental period. I'm talking about ADHD in children, and I will touch base on adult. I will go back to why I put a girl photo or a picture or with regard to ADHD. Girls, because they're emotionally relatively intelligent as opposed to boys tend to be hyperactive, very disruptive. Girls tend to fight that they want to present, they like to be praised, they like to be, you know, told that, oh, you're a good girl, you're nice. So these hyperactivity symptoms at early childhood or at the time when the boys are diagnosed, the girls will present differently. But in what way? If you ask the teacher about that girl whom the parents raise concern about ADHD, the teachers will say, oh, I can't believe you're saying X got ADHD because she's so lovely and she's my right hand. And this is almost a diagnostic sentence for me because the girl is unable to stay still. So instead of jumping up and down and causing troubles and other girls will laugh at her and be mean, she will become the right hand of the teacher. So the teacher, before asking someone for help, that girl will run through and help the teacher and do anything the teacher would like to have. And even the teacher will send her to the office. The teacher will say, how can you get me this? And by that, the girl is moving 24/7 in a very clever way. Girls who are not bright enough to pick that, because not many girls can be the teacher's right hand, she will request to go to the toilet. So you'll find the girl asking to go to the toilet several times, to the extent sometimes the teacher will ask the family, is there any problem because your daughter is asking to go to the toilet several times. Despite that, they manage to, they don't know, of course, that they've got ADHD, but we fail. I will say it's a failure from our end. We fail to diagnose girls earlier. When does the diagnosis hit us on the face? When they hit puberty, because with the hormones, the surge of the hormones and the ADHD symptoms, the situation would become impossible. And that is why most girls tend to be diagnosed around puberty. And they can present with emotional dysregulations. They're all over the place, let alone, I believe we've diagnosed some girls with borderline personality disorder while they were nothing but ADHD. Okay? I hope I'm not going quick okay, types of ADHD, the inattentive, and then we have got the hyperactive impulsive, or we've got a combined type where you got enough symptoms of inattention, enough symptoms of hyperactivity and impulsivity, and they're all together. Okay? All right, I'm gonna touch base, on the diagnostic criteria, because this is very important, mainly for those of you who are responsible for diagnosing adults with ADHD as opposed to children. We've got the ICD versus the DSM. And we've got ICD-9, ICD-10, ICD-11. ICD-9, ICD-10, I believe, when it comes to ADHD, they mention hyperkinetic disorder. ICD-11 talks about ADHD, DSM-4 and 5 talks about ADHD. If we look at the ICD-10 and the DSM-5, deeply sorry, ICD-10, DSM-4, I meant the books behind the current books, the diagnostic books before the current books. You will find the ADHD symptoms or criteria to diagnose ADHD are becoming less restrictive. So it's almost like with this new or the diagnostic criteria, they lax a little bit the diagnostic criteria. You will find that more people now are diagnosed with ADHD, hence the surge. And a recent paper, they said the diagnosis jumped to 50-fold or stuff like that, and the prescription is almost twice. So there is an increase in ADHD criteria, mainly with adults, because the adults who thought that we were missed, okay? But if you are an adult psychiatrist and you're responsible for diagnosing ADHD, and I know you're probably relying on one source. Okay, one of the tips you can use, you can ask the person in front of you if he got school reports, because some of the school reports, I rely heavily on them even with children, mainly when the ADHD questionnaire sent to the teacher is not enough for me and I've witnessed some of the symptoms. So I dig into end of year report to see certain teachers, their comment about the concentration of that child, conduct, hyperactivity. But as an adult psychiatrist, if you manage to assess deep and for your patient to meet this is a personal opinion, ICD-10 criteria, your case will be more valid because you will be finding or digging for more symptoms or DSM-4, because as I said, the symptoms are getting more relaxed a little bit. I'm gonna mention about conduct disorder, because conduct disorder is a common comorbid diagnosis with ADHD, but I wanted you to differentiate between two types of conduct. There is a conduct disorder that appears before puberty, and there is a conduct disorder that appears after puberty. And I will explain to you the difference between the two. The conduct disorder that appears before puberty, the child is normal, and then the child just start to mix with the wrong crowds in the high school, and then his behavior started to be affected. The conduct disorder before puberty, it's normally, if the child is not being diagnosed with ADHD and the child is from relatively a respected family or a family that is moral or behavior is acceptable, a conduct disorder before the age of 10 in a child undiagnosed with ADHD might be nothing but severe ADHD. And conduct disorder or hyperkinetic conduct disorder, when you find a diagnosis of conduct disorder with ADHD or hyperkinetic conduct disorder, this reflects nothing but the severity of ADHD. And when you treat the child with ADHD medications, the conduct will get better, as opposed to the conduct disorder that the child was behaving well before puberty, and then the other one is almost an environmental conduct disorder. The child is mixing with a wrong crowd. Okay, so this is one thing. The other thing as well, there is something called CNVs or copy number variation. I believe you'll find this terminology whenever you're reading research, mainly with genetics. So research into the genetics of ADHD or many of our psychiatric disorder researchers, many when they establish a link with genetic and psychiatric disorder, they said, I give you an example of schizophrenia, leave ADHD. If you got a parent with schizophrenia, and that parent got, say, 3 children, and none of these children developed schizophrenia, name it, any other mental illness. If they don't develop it, that doesn't mean they are not carrying the gene, all right? And that gene, they prove it with the copy number variant, which is a segment of the DNA, and they studied different people with different diseases, and they looked at this segment of DNA, and they found, for example, for ADHD, a child of a parent who has ADHD, and although that child is not showing symptoms of ADHD, might have this CNV with his siblings. So it's just saying that as if you're cutting the disease into pieces and it's spread everywhere, but there isn't enough symptoms to make the diagnosis, or the symptoms are not meeting the threshold, but you will find, if you do a genetic test, you will find the CNV. The other thing I want to tell you about the study, that it's a study for children with ADHD. They studied a group, and this study being repeated several times. If you take a cohort of children with ADHD and you test their siblings for various psychiatric disorder, they found that siblings of a child with ADHD will have more diagnosis of depression as opposed to the general population. So, for example, those of you who's doing adult assessment, one of the things you can confirm just to assure yourself that you're on the right track if you ask for family history of depression, mainly in the siblings. All right, there is another two diagnoses I just want to discuss with regard to ADHD. One of them is epilepsy and depression. Epilepsy or traumatic brain injury. I came across cases when the child was normal, or the child maybe not normal, that child did not develop ADHD yet. So say at the age of 5, child very hyperactive, fell from a balcony or fell from a height, and then develop a traumatic brain injury, and the behavior becomes bad. So the families then will raise a question whether this is ADHD or not, okay? Or a child with epilepsy who was normal before the epilepsy, and then he got the epilepsy, and then with the neurology, whoever is treating that epilepsy, notice that the child is displaying symptoms of ADHD, all right? So we've got two scenarios. When a child was normal, or either the child was normal before he sustains a traumatic brain injury or develops epilepsy, or the child was too young, so the symptoms were not clear of ADHD, and then he developed traumatic brain injury and epilepsy. With traumatic brain injury, people can claim that the child was so hyperactive, restless, to the extent when he fell due to his hyperactivity, he sustains this traumatic brain injury, which you can develop. You can claim that this might be ADHD from the chronology of events. Or the child has epilepsy. This is a little bit difficult, but he's showing symptoms of ADHD. I normally here tend to explain or educate the family more than rushing into a diagnosis. I believe to diagnose here, you're not confident, but we can diagnose what I will say organic, if I'm allowed to say that, ADHD, or I will say that this ADHD actually, these are ADHD symptoms as opposed to a proper diagnosis, because I've got a causation here. The epilepsy, we know people can have a behavioral problem regardless, but when these behavioral problems actually matches all the ADHD diagnostic criteria, you have no way but to diagnose ADHD with caution. And here maybe the drug of choice to treat the ADHD symptoms will be the risperidone. Okay? Let's go to depression. And in depression here, I believe I've talked about this the previous lecture. I said if somebody with ADHD diagnosis and developed depression, try to treat the ADHD. If the depression gets better, well and good. If not, you can increase the ADHD medication before considering an antidepressant. All right? And the depression that is developed here in the ADHD, it's almost like the depression that is in dementia, which we call it vascular dementia. Probably some of you heard about the terminology vascular depression. So this depression is almost secondary to the ADHD. Hence, I need to use ADHD medication to treat it. But be mindful of if you're treating somebody with atomoxetine as an ADHD medication, and when you add an SSRI, because that child can, or that adult can have a serotonin syndrome, because atomoxetine was nothing but a failed antidepressant. All right? Okay. Okay, before I move to ASD, I just want to mention what is called a hidden agendas. And a hidden agendas means somebody who never presented before, mainly for adults, never presented before with ADHD medication, let us say failure in the system, or that person actually would benefit from an ADHD diagnosis. As any psychiatric disorder, it could be problems, and he's facing a court case, and ADHD, because anybody can cook anything and can say anything, and we can diagnose anything, will come to seek a diagnosis of ADHD to be a mitigating factors in court, or university student. Actually, in the UK, we've noticed that university students tend to buy stimulant ADHD medication from the black market to increase their attention and concentration for exams. Okay? So be mindful of these hidden agendas. Anorexia nervosa, I came across this through my career when a child is being diagnosed, a girl or a child being diagnosed of ADHD or not being diagnosed of ADHD, and then got bulimia nervosa and diagnosed also, or got anorexia nervosa, or somebody's on diet and they're failing to lose weight, then they will come to you cooking their ADHD symptoms in order for you to give them a stimulant medication, so you're helping them in losing weight. So I came through my career with 3 anorexia nervosa girls, 2 of them being diagnosed when they were younger, refused medication, and when they realized, because people nowadays, they read a lot in the internet, they've realized that stimulant medication can make you lose weight. So they came to me saying, oh, we need to have our medication, we're struggling to concentrate. And when you look at their academic achievement, they're not these bright girls, or they are not really highly achiever, regardless of their ADHD symptoms. Just be mindful that people are not using the stimulant medication for a hidden agenda or a secondary gain. The army, it's a justifiable excuse here. I can see that. I've got kids who decide to join the army. And by the way, there are many ADHD patients in the army. And one of the conditions to join the army is they will tell you have to be free of medication. I believe it's either 2 years. Don't quote me on this, might be 1 or 2 years. You have to be, if you got ADHD, you have to be free of medication. So the child will come to me and say, listen, stop my medication now. I want to join the army. And most of the time, this child will be high risk with conduct disorder. And there is no way you can persuade them because they are fighting for their career. And you give them that chance. And sometimes they don't get into any trouble with the police, or they're fine, and then they join the army. Some of them stopping ADHD medication, they will just become, their condition will get worse and they will come back to you. Okay, I'm moving now to the ASD. Anybody with any question, please? Hello? Yes?
Just a question about the ADHD again. لأنه الكرايتيريا يعني it's becoming lax, and يعني to make it easier for people to be diagnosed with ADHD, to make it easy for treatment too. If you take it from that perspective. لكن there's an argument that people would say, I tried taking a stimulant and it improved my attention and focus. And then you'll find people going to the primary care physician, whether they self-diagnose themselves with ADHD just based on response to treatment. Could response to treatment be a reason or a factor for diagnosing?
No. Because now I don't have ADHD personally, but if I take ADHD medication, it will improve my attention and concentration. And this is what I told you about university students here in the UK. None of them is diagnosed with ADHD, and I believe a higher number takes ADHD medication. They buy it from the black market, and it's like drinking 10 cups of coffee. So it's not this is what you're trying, a response to treatment might confirm a diagnosis. No, because we know there is a group like 20% or more than 20% who do not respond to treatment. So no, you need mainly the struggle, I believe, with the adult. All right, so with the adult, I believe because we had Dr. Yasser recently, a BBC panorama recently, where we've got 3 patients, I believe, don't quote me in this, they fake their symptoms. Hello?
Check if واحد فتح الميكروفون, just I'll check it again. All right.
They fake their symptoms. And then what happened is after the psychiatrist gave them the diagnosis, they went to the BBC. So it's good, mainly for those of you who are diagnosing adult, is to say, listen, can you bring your parent? or you've got a relative, or can you get me any report from school, any old report? Nobody will get rid of their school reports at all. You know, majority will not get rid of their school reports. And when you write your assessment, you have to mention the resources, that where did you obtain in order for you to reach that diagnosis, you relied on what. All right.
انا will jump into another question. في question في سارة رفع يدها وفي question في الشات. لكن what do you think about the other side for diagnosis اللي هي people who insist not to diagnose ADHD unless they do neuropsychological testing?
I've seen this mainly in adult. You know, people can do various things, but the most important thing for me as a clinician, make sure that you search enough. So in a way, maybe because I'm obsessed, because I've got, you know, I'm very obsessed about court and litigation in the West countries. I make sure that whenever I'm writing, whatsoever are my sources, or whatever way I choose to reach that diagnosis, I have to make it explicit. But with adult, just an advice: make sure that you do not rely on the patient in front of you only. Okay.
Right. Thank you, Sarah.
السلام عليكم. معلش انا دخلت متاخره شويه، لكن بس مداخله بخصوص الادلت اي دي اتش دي، لانه انا دايجنوز ادلت اي دي اتش دي. بس حبيت اقول حاجه مهمه. يمكن في الادلت اي دي اتش دي انا مره بتقولي ناس you will not believe this asking for a diagnosis يعني for an assessment at the age of 60. فما في طبعا في الوقت ده اي طريقه لسكول ريبورت ولا parental collateral type of information. لكن اهم حاجه في الاي دي اتش دي diagnosis عموما في الادلت انه لازم يكون في evidence of impairment. يعني ما ممكن زي يكون مثلا هو عشان حاجاته ماشيه كويسه، لكن مثلا عنده حبه inattention, impulsivity، الحاجات كلها criteria might be there، لكن they're functioning well. الناس دي اشتغلت يعني yes يتعلموا coping mechanisms throughout their life، في masking of symptoms، الحاجات دي كلها حصلت. لكن في الادلت one of the main aspects important انه بعد ما يرول اوت comorbidities دي، ما anxiety disorder، يرول اوت انه الحكايه دي ما بس حصل it's been there pervasive in childhood. لكن اهم حاجه evidence of impairment in at least يعني 2 domains of functioning، be it socially, be it work, be it education, be it relationships, be it different things. فبس حبيت اوضح الحته دي يعني في terms of adult ADHD.
And where do you get the evidence of impairment يا سارة for somebody who's 6 years old?
والله طبعا احنا we have to believe البيشنتس حقنا، لانه at that age يعني it's really difficult. لكن mostly لما يجوك في الايج دي we're not looking for medication. It's much more of an understanding of ليه هم they struggled throughout their life. يعني ليه مثلا اي حاجه took a bit longer، ليه مثلا حاجات بالنسبه لهم were much difficult. For them يعني knowing a diagnosis is helpful in that way. لكن at that age ما في حاجه، ما حد يمزل بعد ذاك stimulant يعني to do what with the stimulant at that age يعني.
just يعني it's we know إنه بالذات في الخواجات هم probably they are more than us. They want to, you know, they seek understanding and الأمور ما مشوها ساكت. لكن still I want everyone to be careful of a trap, because funny enough I was dealing with an adult recently. أنا عموما ما بعالج الأدلت بالADHD ولا بعمل لهم assessment، لكن بمسك ممكن يبقوا adult اللي هو بيكون 19 20 اللي هم ما far from being a child. plus أنا بديت أمسك ديل ليه؟ لأنه الرويال كوليج لحد recently كان عندها فكرة إنه to move a child psychiatry up to 25، وبعدين كنا هنعمل سيرفيس اسمها 16 to 25. بعدين الفاكولتي بتاعت الادلت والتشايلد سايكاتري زي got into debate، انت تمرن منه انا امرن منه. في النهايه هتكون في سبيشال سيرفيس اسمها 18 to 25، والسبيشال سيرفيس دي هيتخشوا فيها. المهم to cut the story short, I came across somebody whom I personally will never diagnose ADHD, will never diagnose that ADHD, and I was treating the girl for something different. And all of a sudden she disappeared from my clinic. This is a private clinic now. She came after a month and she said to me, oh, by the way, I've been diagnosed with ADHD. I said, okay. I said, good luck with that. I said, whatsoever you reported to whatever clinic they gave you that diagnosis, it's well and good. But for me, I did not pick any symptoms through the 12 sessions or God knows how many sessions I gave the girl. You won't believe the girl was caught with a case of plagiarism at the university where she's studying, and she came to know that if you've got ADHD diagnosis, the case will be wiped off. So it was very disturbing for me, and I wish that the psychiatrist who gave her that diagnosis. So people who seek ADHD diagnosis, as I said earlier, be mindful of core problems, you know, because for me, I believe the worst thing, although we cannot be fully immune of out, you know, is that you've been used here. Okay. أنا أرجع لل ASD. Okay.
في question إذا ما عندك
Mhm.
مشكلة برضه في الشات. في question من أحمد and asking about your thoughts on technology decreasing concentration, which can mask as inattention, mainly because of short content epidemic.
هم طبعا التكنولوجي دي almost زي سلاح ذو حدين. في ناس كثيرة زي complained إنه التكنولوجي فعلا impairing the concentration, and when they restricted the screen time, they discovered that the children attention and concentration has improved. في debate كبير about that, لأنه nowadays most of the school we are moving towards in الناس to use the technology, but maybe using it في stuff that are trivial, that is as a method of distraction, as opposed إنه الإنسان ده أصلا عنده distraction. فالحتة دي صراحة احنا we know the excessive use of smart devices دي affect many, they are used for fun, and people said minimizing it improves the screen time, but whether behind this there is an ADHD diagnosis or not, I have no idea. Does that answer your question? Hello?
It's in the chat فغايته نشوف
Okay, fair enough. Okay, can I do my best to finish this bit
Sure.
of وبعد ذاك hopefully نلقى الوقت للquestion. ASD. ASD, we know there are two types, high functioning and low on ASD or whatsoever. We know the difference between the high functioning and the normal ASD is mainly the IQ في الحقيقة. لأنه ال ASD ده بيقع في السبكترم، والسبكترم mainly مشرور فيه ال IQ ذاته. والهاي functioning autism we know إنه عندهم very high IQ. Some of them I've seen 147 IQs صراحة. All right. We know إنه الهاي functioning ما عندهم impairment في language most of the time، أو حتى لو في delayed language بتصلح وبعد ذاك هم high functioning. لكن في low functioning اللي هم language بتختفي طبعا. طبعا اللانجوج الناس بتقول انها بتختفي، وهي اللانجوج ما بتختفي عشان الناس بس الامور دي مسح ليها، لانه اللانجوج شفتوه طيب في البروبر لانجوج اللي بتكلم بها هسه، وفي البابلينج اللي هي بابا ماما. البابلينج ده اللي هو اللي ستارت بيفور ذا ايج اوف 1، وبيقوم يقول لك ات ذا ايج اوف 2 الطفل بقى ما بيتكلم. هو ما في طفل بقى ما بيتكلم، هو اللانجوج did not develop، والبابلينج is not a language. اوكي. طيب انا هأمسك معاكم بس قصة اللانجوج دي لأنها دايما مهمة شديد، ودايما الناس اللي ما اكسبيرينس بيقعوا في الفخ بتاع الديليد لانجوج ده، بيقعوا في الفخ بتاع الديليد لانجوج. بيجيك طفل عمره 2 ما تكلم، بيقوموا بيمشيوا لدكتور بيقول له عنده ديليد سبيتش. الدكتور ولا المهم والله الدكتور ذاته كثيرة، التيتشر، الجيران، الناس البروفيسورات اللي بقول عليهم الحايمين ديل، بيقوموا يقول لزولا عنده توحد، والفاميلي تو ستارت تو بانيك، والبيهيفير ده منتشر في الخليج شديد خلاص. لو جاك طفل عنده delayed speech بليز 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 at the age of 2 الطفل ده ما بيتكلم، ما تركز لي في انه بيعمل يدينه كده ولا ما بشوف الكلام الفارغ ده كله وقفوه. Please take this child to audiology department, and what I mean here check الهيرنج، اعملوا له hearing test. لانه الديلايد سبيتش انا لو ما سمعت اللانجوج هتكلم اقول شنو؟ اذا لانجوج انا ما سامعه هتكلم اقول شنو؟ فبليز انا عندي ستيبس دائما بقول للناس تو فولو قبل ما يجيبوا لي الطفل بالتهمه بتاع الديلايد سبيتش. بليز تشيك انه الطفل ده بيسمع. اول ما الطفل اتاكدت انه بيسمع بليز 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 دو نوت جامب برضه للتوحد. اعمل لي سبيتش اند لانجوج ثيرابي، الصوت بيقولوا على الصوت. اعمل سيشنز وانا هقول لكم السبيتش اند لانجويج ثيرابيست ديل زي ما بيقولوا في السودان خشم بيوت. ان وات سنس؟ انا ممكن امشي للسبيتش اند لانجويج ثيرابيست يقوم يقول لي اوه صحيح في ديلايد سبيتش، هعمل لكم 5 سيشن، هعمل لكم 6 سيشنز. اكسكيوز ماي لانجويج، ده ربش برضه. a proper speech and language therapist بيعمل شنو؟ بيمسك الطفل ده بعدم الكلام ده بيعمل له فول اسسمنت، بيقوم بيقول لك انا ده الاسسمنت البدائي بتاعي اكتشفت كده، والجول بتاعتي في 6 شهور هيحصل كده. بعد 6 شهور يا بيحصل تقدم او ما بيحصل تقدم بيقوم بيديك بلان تانية. انا للطفل اللي ما بيتكلم نهائي اذا في decent speech and language therapist وانتنسيف speech and language therapy بقول للفاميلي جوني في سنة ونص، جوني في سنتين، بقول لهم اعملوا لي speech and language therapy سنة intensive وتعالوا راجعين. believe me كمية الناس الجوني راجعين بعد سنة وما في أي شيء عند الطفل ده، الناس بيجيها delayed speech وفي ناس بتتكلم بس في الشفة ده. sorry
I
anyhow.
think someone's microphone was on. Don't worry, Amani.
اوكي سو انا خلصت الايديولوجي، بعدك بعمل سبيتش اند لانجويج ثيرابي. وانا هقول لكم شده ملي سبيتش اند لانجويج ثيرابي ده بيعمل لي قلق. انا بتذكر في فتره الكوفيد كنت شغاله في الخليج، فقاموا جوني ناس من الفلبين، قاموا قال لي ولدنا ما بيتكلم فقلت لهم عملوا لي الهيرنج تيست، فقاموا قال لي احنا متاكدين انه بيسمع، كان ايام الكوفيد. قلت لهم خلاص انا داير سبيتش اند لانجويج ثيرابي. قاموا قالوا لي نجيبه من وين مع الكوفيد؟ قلت لهم ان شاء الله اونلاين. انا داير الطفل ده يتعرض لبروبر سبيتش اند لانجويج ثيرابي وبعدك تجيبوا لي. وفعلا في فاميليز مشي اونلاين لانه كان غالي في الدول العربيه، مشي اونلاين في بلادهم والطفل بدا يتكلم. بعد ما اخلص السبيتش اند لانجويج ثيرابي انا غرضي شنو من الحته دي؟ غرضي ديفرنشيت الكيسز بتاعت اللو اي كيو من الاوتيزم. او ما في ناس باللو اي كيو بيتعلموا سلولي برضه، ما باي ذا واي ما اي ديلايد سبيتش وراه لو اي كيو. لكن انا دايره بعد ما امكن الطفل ده من اي لغه according to his cognitive ability، دايره بعدك اشوف الدور بتاع الاي كيو هنا شنو versus الاوتيزم. بعد ما انفذ الحاجات دي كلها بعدك انا بيرسونالي حتى بشخص اي اس دي، لكن الليبلينج والصيغ بتاع الاي اس دي ده رايت ليفت اند سنتر I believe is a wrong practice. Please follow these steps لانه الفاميليز بتتوجع وبتتخلع، والناس دي بتلصق الدايجنوز بتاع الاي اس دي ده كانه زول عندك يا اخوي عندك نزله. الاي اس دي ده دايجنوز تقيل تقيل تقيل، فلو ما تاكدتوا بالذات مع الناس الصغار. تاني boys versus girls boys versus girls. في الاولاد ما بعرفون انا، لكن الاولاد عموما عندهم الديلي سبيتش ده almost زي في ماجورتي في الاولاد، في ما ماجورتي يعني في برسنتج من الاولاد عندهم ديلي سبيتش بعدك بيتكلموا. I came across number of boys لحد 4 سنين الولد كلمه ما تكلموا، بعد ذاك اللغه حقته انت بتقول قاعد لك مع زول اخصائي لغه. الاولاد عموما بيتكلموا ليت ما زي البنات، لكن الستبس دي needs to be followed قبل ما انا امسك اللانجويج و I will tick that box as an evidence of autism. Okay? I hope the point very clearly. عندنا second point اللي هي بتاعت الكوميونيكيشن سكيلز، اللي هي mainly انا بتكلم عن النون فيربال. ما هي القصه ما بس انه الطفل ده ما عنده لغه، النون فيربال سكيلز او الكوميونيكيشنز بتاعته مثلا زي الاي كونتاكت. لكن برضو انا بقى صرت بقول انا لو ما عندي لغه دلوقتي، انا لو ما عندي لغه مع زول ما في حاجه تخليني اعاين في عيونه. انا بعاين لزول في عيونه لما انا اكبر واوعى. انا بتكلم على الاطفال الصغار كويس. الاطفال الصغار ديل ما دو نوت جمب للبور اي كونتاكت انه نون اي هو probably significant، لكن انت برضو اتاكد ان الزول ده بيسمع، اتمكن الزول ده من لغه. فعشان كده انا عندي اللغه دي حاجه مهمه جدا. بلس عشان اقول لكم عشان الناس برضو قصه اللغه، ما في ناس تقعد تقول لي يا دكتوره كده طيب دقيقه انت ما تحس الحاجات الثانيه اللي هي مثلا الستيريوتايب بيهيفير والنون كوميونيكيشن. قبل ما تمسك اللغة. أنا بفتكر قصة اللغة دي مهمة، لأنه to my limited understanding و I hope إنه الحاجة أنا ما ماخذة لي wrong حاجة في راسي. A language center in the brain stopped developing at the age of 7. In what sense? It develops, but لو أنت ما غذيته، يعني لو ما تعلم language لحد ال age of 7، بعد ذاك أنت بتقدر تعلم الزول اللغة. فالسنتر ده almost إحنا من السايكولوجي almost زي it lose its ability للتعليم. لكن أنت once إنك تعلمت اللغة، بعد ذاك البرين ده ذاته الجراي ماتر ذاته بتكبر. فبقول لهم يا جماعه انا عندي اي شيء ملحوق، لانه بيقول لك لكن هو المفروض يخش اوتيستيك سكول ومفروض يعلموه. انا ده كله ما بيعنيني نهائي. اهم شيء عندي تلحق اللغه، وبعدين اللغه هنا بستفيد من حاجتين. اذا ما عنده اوتيزم بطلع من الكاتيجوري دي كومبليتلي. والماجورتي بالمناسبه الchildren I came across with delayed speech او we'll say 90% منهم ما كانوا اوتيستيك، كان في delayed speech وتصلح، او كان في LD. لما انا اصلح اللغه وادي دروس لغه كويس، اذا اللغه اتصلحت ولا نقول طلعت الزول ده من الليسته حقتي. اذا الزول ده طلع اوتيستيك، هو برضه هيستفيد من السبيتش اند لانجويج، لانه واحده من علاجات الاوتيزم هو السبيتش اند لانجويج ثيرابي. فانت in a win-win situation. لكن مثلا الناس تقول لي انا I came across a child recently في الستيتس، الفاميلي جاتني قالت لي يا دكتور احنا we need applied behavioral analysis، وانا شركت في كده ودفعت لك كده، ولا الانشورنس بيدفع لي كده. قلت لها this is for me is a waste of time. الابلايد behavioral analysis ده انا بجيبه later. انا حاسه دايره لغه، بعدين انت يعني انا بشرح للناس قصه اللغه دي كيف. بقول انا حاسه اماني لو ودتني الصين كويس، ما بعرف لغه صينيه، وقول ما في اي دول بيتكلم انجليزي ولا بيتكلم عربي معاي، انا هجيف هعاين للناس في الاول وانا ماتيور. لاحظ انا not talking about 2 year old. هعاين للناس ما في زول فاهمني، هشرح بيديني ما في زول فاهمني، في النهايه I will isolate myself. اعاين للجنبي ليه وهو ما فاهمني، اتكلم مع يعني في النهايه I would rather isolate myself. فدايما بقول للناس اللي عندهم delayed speech please 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 invest في السبيتش قبل الايج اوف 7. invest في السبيتش عشان البيدياتريشن ولا السايكاتريست ده يعرف what is he dealing with، وبعد ذاك خلوا لنا على الكوميونيكيشن سكيلز والنون فيربال والستيروتايب الكلام ده الفارغ ده كله خلوا لي نمره 2 كويس. نيجي للريستريكتد behavioral repertoire اللي هو السير diagnostic criteria بتاعت الاي اس دي. يعني انا I came through حاجات I will say painful as far as the word person is concerned. يقوم يقول لي يا دكتور الشافعي بيعمل كده، او الشافعي يده ما بعرف شنو، والشافعي يعني صراحة في حاجات بالنسبة لي meaningless. لأنه بالمناسبة في symptoms كثيرة أو في mannerism كثيرة بيعملوها الشفع بيعملوها الناس اللي بالLD كويس. أنا if you ask me ASD with a low IQ is more serious than LD alone. لكن يعني إحنا بقينا في دايلما 2 dilemmas هنا. أنا بالنسبة لي hierarchy wise ASD severe ASD اللي هو بيكون معاه LD طبعا إذا diagnosis أكعب من LD براو كويس. لكن إحنا في الدايلما اللي بنلقاها وزر في الوست أو حتى في مجتمعاتنا العربية، إنه الناس زي prefer مليون مرة إنه طفلهم ده to be diagnosed with ASD ولا يقول عليه متخلف عقليا. يعني تقول لك عنده توحد كويس، تقوم تقول لا لكن ما برضو. انا بالمناسبه قصه ال دي almost زي سفيره ال دي يا جماعه. في ال دي هنا هم الحته دي لا دارين يسمعوها ولا دارين يفهموها، في حين انا بحس انه انت يعني اي اس دي ما خلاص هو اسم في النهايه، سميه اي شيء، لكن الحاجه دي فيها شنو جوا. ما في vulnerability، وفي طفل هنا عنده needs endless، وفي كمية من الحاجات الكومبليكيتد المحشورة جوا الدايجنوزيس ده. لكن السيرج حس احنا عندنا حتى في الويست بتاع ال ASD diagnosis I personally believe most of it is disguised purely. اوكي، دي الهيدن اجنده بالنسبة لي بتاعت ال ASD، انه actually ما حاجة راغية او بصمة عار. غير كده طبعا عندنا في الويست هنا I'm not talking sorry about the whole West, I'm talking about the UK specifically. انت لو عندك ASD شويه بتتفتح لك ابواب الجنه، LD عندك زي شباك مفتوح. This is more or less the most important bits بتاعت ال two neurodevelopmental disorder left. عندي 9 دقائق أو 10 دقائق لأي زول عنده question.
والله ماني ساره هنا معاكي. ثانك يو فيري ماتش. طبعا الاي اس دي ده زي ما انت قلتي هو اتس ميجر دايلم، بعدين حاسه بقى ذاته زي شويه كده فاشنبل دايجنوزيس. ف اتس ريلي بروبلماتيك. فيعني انا was really pleased to hear منك قصه حكايه اول حاجه حكايه اللانجوج، يعني as an important thing، يعني ذاتها you need to صحيح definitely that out before حتى proceeding لانك تعمل diagnosis حق الاوتيستيك سبيكترم ديسوردر. simply بس أنا يعني سؤال هنا مثلا انت what age do you usually مثلا diagnose ASD يعني generally when do you start مثلا in terms of diagnosis يعني diagnosis type of assessment يعني how old عادة الأطفال بيكونوا؟
أنا صراحة بحب الناس اللي بتيجي في الage of 2 دي كويس، لكن في الage of 2 ما بشرح الشرح. طبعا الage of 2 ده اغلبا او 18 months، ناس تيجي بدري 18 months دول طبعا بيرجعوا ولا بقابلهم، لكن في 2 years بقوم طوالي بقول اللانجوج دي الحقوني بها كويس. الطفل بخليه معاي في الكيس لود حقتي، بيقوم لما يقولوا لي لقينا سبيتش لانجوج ثيرابيست بشرح لهم قصه انه ما ده بقى السوق ماركت مليان فيه الصالح والطالح. بشرح انه انا عاوزه بروبر ASD اسسمنت وداير الاسسمنت ده اشوفه بيجيبوا لي كويس. بشرح لهم حتى شفتوا بمسك معاهم الريبورت ده، بشرح لهم الجولز اللي كتبها بتاع ASD ده بتاع سوري السولت، وانه احنا هنتحرك نمشي وين. بعد ذاك بشوفهم كل 6 شهور. 6 شهور ده عشان اشوف قدر اللغه اللي اتعلمها الطفل. بتحسي بعد شويه الاي كونتاكت بدا يتصلح، يعني السيمتومز اللي كانت بور سوشيال الحاجات دي كلها بتبتدي تختفي لما اللانجوج تظهر كويس. لما القى الطفل بطيء، ما انت الطفل بتاع ال دي بيوضح لك سبحان الله. الطفل بتاع ال دي بتلقى عنده جود اي كونتاكت اللي هو ما اوتيستيك، لكن كلامه بطيء وبعد ذاك اللغه اللي بيتعلمها لما تيجي تماتشت مع الايج وكلمه الفوكابلري المفروض تكون في زول عمره 3 years و 4 years بتلقاها لس. الطفل الطبيعي بتلقي فجأة الفوكابلري ده نطه وتصلح ليكي، لكن ريلاتيفلي كده انا بحس مرتاحه ومطمئنه في الايج اوف 4.
اوكي
لانه عندي
فانت
الاولاد
عارفه طبعا انت عارفه يا ماني انه قصه الاوتيزم دي is very close to my heart، يعني انا النيس حقتي عندها is on the spectrum طبعا. سؤال لك هنا، يعني هي ما شاء الله حاسه هي في الكوليج وكذا ما شاء الله شديد بال، لكن واحده من الحاجات انا بتذكر انا كنت شاورتك فيها زمان يعني and it might be helpful for people to know لما كانوا اهلها مصرين انه thinking about امشوا special school ولا كذا، هي ما كان في LD وانت كان كلامك انه try and normalize rather than انه to pathologize. فانا I always يعني that always stuck with me انه try and normalize the behaviors which طبعا that was the best thing ever يعني بالنسبه لها. ف thank you يعني. بس I wanted to mention قصه الخاصه بيكون ما في LD انه الناس ما تجري بسرعه على انه اي حاجه تكون سبيشالست.
exactly بالذات الهاي فانكشنينج اوتيزم ديل. طبعا احنا بنتكلم عن 2 جروبس. الهاي فانكشنينج اوتيزم لاحظهم ما شوفوا احنا عندنا الهاي فانكشنينج اوتيزم هم كان زمان اسمهم الاسبيرجرز وتشال الاسم. الهاي فانكشنينج اوتيزم ديل لانه اللانجوج طبيعيه او حتى الديلي بيكون في ديلي سبيتش، لكن يقول لك بعد ذاك يتكلم بسرعه عجيبه. الاطفال ديل زي جود دايجنوز ليت بالمناسبه من 9 وانتوا طالعين، لانه الاهالي بالنسبه لهم كلنا الناس كلها عندها الفهم، عشان كده الحته دي بتضايقني شديد خلاص. بحب اوضحها وبحب اطلعها برا سكتي. عندهم الطفل اللي ما بيتكلم عنده توحد، ما بيقوم الطفل اللي يلا بيتكلم كيف يكون عنده توحد؟ ما هو تكلم، ما هو بيتكلم المشكله شنو؟ اوكي الطفل ده اتكلم ما في حاجه. امين اللكشر الطفل ده اتكلم ما في حاجه يعني ما. عشان كده حتى احنا كومبلينز اللي بتيجي في الترس بتيجي انه يقول لك انا ولدت شخص ليت، بمسك الاهالي ده بفهمهم بقول لهم يا جماعه الناس عموما زي جيت ورد لما يكون في ديلايد سبيتش. انت طفلك ما عنده ديلايد سبيتش بتحاولي تزحي من الكومبلين بانك بتنفخيهم ده هاي فانكشنينج اوتيزم وده الجروب اينشتاين وده جروب الناس العلماء تمليهم هوا كده عشان شويه الكومبلين تزح من الترس. لكن unfortunately الهاي functioning autism طبعا زي got diagnosed late و mainly زي struggle with severe anxiety لأنه بتيجي قصة إنهم هم ما قادرين to form relationship. وطبعا الأطفال في المدارس هنا they are so mean they pick on somebody who's odd straight away. لكن جمال الطفل الهاي functioning autism لأنه برضو الآي كيو عالي they start almost to learn it's fascinating to watch. start almost to learn الحاجات اللي ما بتوقعني في problems والحاجات اللي بتخليني إنه أنا ما to pick on me اللي هي لو أنتوا لاحظتوا قولوا نحن جروب الدكاترة فرضا أو الشغالين في الوست أو الدكاترة أنت as you grow up بتكون حذر جدا في كلامك اللي بتقوله. وأنا ديل لا ما أنا هنا لو قلت كده بيفهموني كده ودي ما society أنا ما بعرفها. you almost start to employ your IQ in communication mainly مع ناس ما أهلك. ف almost ده اللي بيعملوه الأوتيستيك children from a very young age. I hope I just made this clear a little bit.
ثانك يو فيري ماتش يا ماني. افتكر في سؤال في الشات هنا، في سؤال بيسال من الانتي ديبريسنتس فور autistic spectrum disorder anxiety if that is the only symptom that is distressing.
Yeah. Okay. أنا I'll tell you about my normal practice. طبعا الانزايتي باي ذا واي في الاي اس دي is higher than the normal population anxiety. يعني انا زي بقول الليفل السيلينج هنا بتاع الانزايتي حقت الناس اللي will develop anxiety الاوتيستيك سبيكتروم ديسوردر هاي فانكشنينج ولا لو فانكشن الانزايتي بتاعتهم فوق why sorry why so high so way so high sorry. بقوم بعمل شنو انا؟ عندي two drugs I choose from them either SSRI sorry two groups either SSRI or antipsychotics. بستعمل ال SSRI إذا ما في violence and aggression. إذا الانزايتي بتاعته دي الفرستريشن ما بطلع فيني anxiety واجريشن بمشي لل SSRI. إذا في anxiety طلعت لي aggression و violent behavior بمشي طوالي لل SSRI. طيب وأنا عندي طبعا two hidden agendas behind this. الأجندة الأولى مع ال SSRI أنا قلتها في لكشر فاتت إنه زي trace ال ASD later on زي develop bipolar some of them not all of them طبعا percentage. فبكون ما دايرة to precipitate ال bipolar to be induced by ال SSRI. طبعا ال SSRI المانيا sorry المانيا will be induced by SSRI on somebody who's genetically prone to. فبكون بدي ال SSRI دي وبحذر. إذا في violence and aggression ولا بتردد. اللي بيخليني to choose الاريبيبرازول for example versus الريسبيريدون child weight لأنه معظم الناس ال ASD ديل تلقاهم يعني شوية كده زي أنا ما هقول زي eat too much لأنه أنا I believe قصة الأكل الكثير دي is a coping mechanism من البيرنتس بيحاولوا يلهوا أولادهم بأي حاجة سكرية عشان الطفل ده behavior wise to settle. I hope this answered your question.
I think that did. أماني في حاجة بس now that we're talking about medication هل عموما في زي عموما الحاجة المعروفة إنه ناس ال ASD are very sensitive to psychotropic medication. يعني do we have to be really quite careful؟ بس عايز to emphasize القصة للtrainees about the dosing.
okay I'm so يعني ما بقدر أشكر كفاية في الكويستشن ده. By the way a neurodevelopmental disorders ال ADHD الهلولة دي كلها لما أنا أدخل element of LD حتى لو نملة أو حتى من غيرهم البرين ده is compromised number one. حتى لو ما compromised البرين طبعا أغلب البرينز دي very compromised. لو البرين ده ما compromised أعرفوا حاجة واحدة إنه لما جو الناس الريسيرشر يعملوا الريسيرش بتاع ال SSRI or psychotropic medication or whatsoever medication name it they've been excluded from a research for ethical reasons. فالبرينز دي ما تستت احنا ما عارفين الدواء لكن جس من شغل practice wise لأنه أنا بشتغل مع neuro developmental disorder حسب فوق 13 سنة إنه a low dose of medication و going up slowly أنت بتتخلعي لدرجة هل واحد فيكم ممكن يصدق إنه أنا عندي patients في 4 ملغرام of fluoxetine 4 ملغرام of fluoxetine اللي هي 1 ml لانه الفلوكسيتين ال 20 ملغ الليكويد منها بيعادل 5 مل، بدي 1 مل. ال 1 مل ده الام بتقول لي انا ما عارفه انت عملت شنو في الشافع، لكن this is not يعني انا I'm over the moon. لما في الاطفال اللي عندهم نيورو ديفلوبمنتال ديس اوردر انا بمشي ل 8 مل. الهايلي فانكشنينج اوتيزم most of the time I end up with صراحه I end up with risperidone 0.25 ملغ twice a day. عندي الطفل واحد بس في الكيس لود حقتي كلها نورمال اي كيو هاي فانكشنينج اوتيزم، ده قاعد في 1 ملغ اوف ريسبيريدون توايس ديلي، لانه one of the serious cases قاعد مع البوليس، انا قاعده مع البوليس بعالج في الولد ده. لكن اغلب البيشنتس حقني افريج افتر بيوبرتي قاعدين في 0.5 ملغ ريسبيريدون بي دي.
خالص الشكر يا أماني، خالص الشكر. ياسر عايز to add something قبل ما نشكر أماني على يعني والله يعني we can't thank you enough للسيريز حقت النيو ديفلوبمنتال ديسوردرز، الثلاثة لكشر تيلا يعني educational informative و engaging و interesting as well يعني. ف thank you very much يا أماني. ياسر do you want to say something؟ أنا لأنه الليلة I wasn't there in the beginning فاحتمال تكون بديت تشيرنج بحاجة.
لا انا زي ما انت قلتي يعني شفتي انا have been enjoying every single lecture of اللكاشر اللي بتديها دكتور اماني دي. يعني it's very entertaining the way يعني the passion بتاعتك في الموضوع ده the experience behind it, the angle حتى the clinical peers اللي you discuss يعني دي حاجات ممكن ما تكون في الكتب. فدي it's really important for clinicians حتى اللي يعرفوا الانجلز دي شديد. فغايته يعني متشكر لك شديد على زمنك وعلى التقديم وعلى اي حاجه يعني الليله. يعني هنا ما قصرتي معنا كله. الترينيز كان بيسالوا من هناي من السلايدز، افتكر لانه في جزء من خلينا نقفل التسجيل ثواني. في جزء من هناي الناس